Hi, everyone. My name is Azhar Kothawala. I'm one of the anesthesiologists, but I specialize in interventional pain management here at KSB Hospital. And I was asked to talk a little bit about pain. September is Pain Awareness Month, and it's obviously something that many people suffer from. And so my goal over the next 5 to 10 minutes is to speak about a variety of topics related to pain, but specifically maybe talk a little bit about what pain is, or at least the medical definition of pain, what its impacts are, both personal and maybe on a societal level, and also what we can do about pain, because there's a variety of treatment options, including treatment options that we offer here at KSB Hospital to help people who are suffering from pain. So, chronic pain and pain of any sort is obviously very common. Every one of us deals with pain every once in a while, at least. But there are a large proportion of people in the United States, roughly maybe a third of people, who suffer from chronic debilitating pain. This is more people than that suffer from cancer, heart disease, and even diabetes combined. And so, what is pain? According to the International Association for the Study of Pain, the specific scientific definition of pain is an unpleasant sensory and emotional experience associated with either actual or even just potential tissue damage, or described in terms of such damage. So, in other words, it's a subjective and entirely individual personal experience that's influenced by a variety of factors, including learning and context and a multitude of psychosocial variables. And to break it down even further, so again, pain is a subjective and highly individualized experience, but the trigger or the stimulus that can cause pain could be physical, but it could also just be mental in nature. And we also know that the degree of pain that someone might suffer from or complain of isn't necessarily proportional to what we can objectively see, whether it's like an injury or it's like degree of arthritis in their back or what have you. Additionally, we know that pain can interfere with personal relationships and even influence a person's meaning of life. And really, at the end of the day, there's no completely accurate or objective test to try to tell how much pain or what kind of pain a person has. It's just we have to rely on the person and what they tell us. Only the patient knows whether the pain is present and how that experience feels to them. In terms of the neurochemical pathways and the neurochemistry of pain, we do know that the peripheral tissues, meaning whether it's your fingers or a hand or your skin of some area, they might sense a noxious stimulus, some sort of thing that might potentially cause the body harm. And then there's signals via small peripheral nerves, and then that transmit into bigger nerves and then to the spinal cord and up to the brain to send those pain signals to the brain. But then what happens secondarily, how the brain processes those signals and how it reacts to them, is influenced by a variety of factors, including your prior experiences, how much your attention you might be paying, whether you have expectations one way or the other, even your mood, or even if you suffer from certain mood disorders, anxiety or depression, for example. There's a variety of neurochemical and structural changes that can influence your perception of pain and your reaction to it, genetic factors, etc. In terms of pain, that this is just kind of a wide bracket, but basically there's a variety of different subtypes of pain. So you can have nerve-related pain, musculoskeletal pain, pain from inflammation, visceral pain, so pain from different organs, and even less common causes of pain, such as opioid-induced hyperalgesia or opioid-induced pain. You can have pain that kind of falls into different timelines. So there's acute pain, which is usually in response to obvious tissue damage. This has a function. There's a protective function because, for example, if you were inadvertently touching, say, a hot iron, your body needs to know to pull away your hand so that you don't continue to get burned. And so this also has additional benefits in that it can ramp up your sympathetic nervous system, so that way you can maybe potentially run away or pull away from an offending agent, or fight it off, and also potentially speed up healing. Typically, acute pain resolves once your body is healed from that initial damage or injury or surgery. Chronic pain, however, is one that exceeds beyond the expected period of normal healing. This pain doesn't seem to serve any clear purpose, and instead can be detrimental. It can degrade health, it can degrade your well-being and your functional level, and it oftentimes is associated with changes of the nervous system itself. And so pain, especially chronic pain, can therefore influence and impact people's lives in a variety of ways. Dr. Katz here kind of outlined that it can lead to anxiety and emotional distress. It can undermine well-being. It can interfere with functional capacity. And it can also hinder your ability to fulfill family, social, or vocational roles. What's also clear is that there's certain psychological conditions that are so common in people who suffer from chronic pain that they essentially almost go hand in hand. So it's obvious that someone who suffers from chronic pain on a day in and day out basis would develop depression. But what's also become clear is that people who suffer from depression are more likely to develop chronic pain as well. And in fact, about a third of people who suffer from a depressive episode also experience at least one episode of severe pain. And 60% of people who suffer from chronic pain also meet criteria for depression. And so because of this, we know, for example, that in trying to treat people's chronic pain, if they also suffer from depression, which again, the majority do, it'll be very difficult to adequately treat their chronic pain without also addressing their depression, or for that matter, other issues such as if they develop or suffer from poorly controlled anxiety, or catastrophizing issues, things of that nature. Pain can obviously influence not just the person who's suffering from it, but influence and impact their family and loved ones, as well as society in general. So even using more stringent criteria for what chronic pain is, about 1 in 5 people, adults in the US, I should say, have some sort of chronic pain diagnosis. And about 20 million people in the US have what's termed high impact chronic pain, where there's an impact of that pain on life or work activities. And in terms of the financial impact of this, it's estimated that about $560 billion in the US are lost due to direct medical costs, lost productivity, and disability programs. Treatment options. Fortunately, there are a variety of treatment options, including ones that are offered here at KSB Hospital. Despite what the slide seems to indicate, that's not just limited to medications. So what we found is that multidimensional pain or multidimensional care for chronic pain is most effective. And the focus of this is not just reducing pain or, for example, reducing the pain level or number that a patient will give you, but also improving their well-being, restoring their function and activity level, and also improving their overall quality of life. And so this is done via 4 basic strategies that we try to utilize together. There's a psychobehavioral aspect. So this can, as we alluded to before, involve treating underlying mood disorders, but also things like cognitive behavioral therapy, addressing issues maybe with substance abuse, meditation. There's a variety of procedural treatments that we offer at KSB Hospital. So, for example, in the pain clinic, we do everything from nerve blocks, a variety of steroid injections, to more involved treatment options such as minimally invasive procedures like stimulators and decompressions that target specific pains very effectively. There's a variety of medications that can be prescribed or recommended for chronic pain. And then finally, physical therapy is an instrumental part of treatment of chronic pain. And this can include a carefully supervised exercise plan, manual therapies, orthotics, and even other therapies such as TENS and topical agents. What's interesting is that not only is multidimensional care for chronic pain more effective than a unidimensional care, but it's also more cost effective as well. So to address chronic pain, to review, one of the other things that's important is to ensure that the patient feels like an active participant in their plan of care, and to try to create and execute a biopsychosocial treatment plan to that end, specifically to try to develop a treatment plan that tries to utilize all different modalities, not just relying on pain medications or specific pain medications, and focusing on restoring function and not just decreasing a certain pain number. To that end, again, at KSB, I mean, we're fortunate, and I feel fortunate to work at a facility and hospital system that offers the whole treatment option, and that includes medication management, physical therapy, whether it's at KSB Hospital or a referral to somewhere that's maybe more convenient to you if you live further, psychological counseling, injection therapy, and surgical options for different types of pain. This is just a slide to briefly talk about pain medication. Oftentimes people think of pain medication as just opioids. As we talked about briefly before, opioid medications can be helpful for short-term pain, but they tend to not be very effective for long-term pain, and they're fraught with risks that we'll talk about in a second. There are a variety of other pain medications though, that are non-opioid, and these include over-the-counter medications such as anti-inflammatories, Tylenol, certain antidepressants, and certain seizure medications can be very effective for certain types of pain, especially nerve pain, and different musculoskeletal conditions. And then even topical agents can provide some degree of pain relief. And so oftentimes, at least in the pain clinic, we'll try to utilize different modalities, not just for pain control, but even with medicines, try to target pain from different angles, if you will, or try to target pain based on the type of pain we believe you're having, whether it's an inflammation pain or a nerve pain or a musculoskeletal pain. Opioids have been in the news, obviously, for many years, and it's because we had we have an epidemic going on with opioids and opioid related deaths. In 2016, for example, almost 2/3 of opioid deaths were related to prescription medications and prescription opioids, and that's a number that's been climbing since the early 2000s. More recently, that's continued to be shown to be the case. And part of it is not just the risk for overdose for patients who are on opioid medications, but also concerns with long-term side effects that opioids may cause, including a variety of effects on your mood, on different hormonal levels, and things of that nature. And additionally, the fact that the benefit is actually been shown to be most effective for short term, with very little benefit that's been clinically shown to last longer than just a few weeks to a few months. Now, going back to behavioral and psychological therapies and this is admittedly a little bit outside of my area of expertise, but there are a variety of psychologists and psychiatrists that are available at KSP and partner with KSP that can help patients with these interventions and therapists as well, I should say. And so these involve developing realistic expectations and goals, training patients in relaxation techniques. Cognitive behavioral therapy is highly effective, and there's many studies that show the benefit of this for chronic pain. Activity pacing, and then also involving family and family interventions to try to help patients who are suffering from chronic pain. One of the goals of psychological therapy is to try to separate pain from suffering, such that ideally you have a patient who, even if he or she says that they still deal with a certain pain level or intensity, also then report that that pain doesn't seem to impact them quite as much, that they're able to still maintain their sense of well-being, that they're still able to maintain their relationships, that they're able to function and have a decent quality of life, and that they don't feel that their pain is kind of inhibiting all aspects of their well-being and their identity. And then a final slide for people who have loved ones in the family, or maybe a spouse, or even just a friend who suffers from chronic pain. This is just some general advice, but try to support your loved one's self-management and remind them that even if they feel that they don't have control over their pain level or what may aggravate their pain, they do have control over how they can let that pain affect them and their suffering. Try to ignore unhelping coping behaviors such as resting and inactivity, and instead reward and encourage behaviors such as exercise and paced activities. And then finally, try to decrease hovering and overhelping, and in a similar sense, try to avoid kind of encouraging painstaking behaviors or behaviors where patients really internalize pain as being their kind of primary identity, and help them kind of get over that hurdle if you can. Also, if you have someone who suffers from chronic pain, a loved one or a family member, or if you yourself do, don't hesitate talking to your primary care, talking to someone, a healthcare professional, a family member for sure, if you feel comfortable about it. And if you haven't already, try to seek treatment for it. Even if you feel like, well, I've had medical treatment for this in years past, and I was told that nothing could be done. There's always new strategies, always new information coming out, and you might be a good candidate for a treatment option that we can offer. Thank you.